and welcome back to another video of Medic Notes. This video will be on oligohydramnios. Oligohydramnios is when there is reduced amount of amniotic fluid, and it is defined as amniotic fluid index less than 5 cm or less than 5th centile for the gestation for babies around the same age. So in the third trimester, a normal amniotic fluid index is around 10 to 25 cm. If less than 10 cm, it is reduced in amniotic fluid volume, and if it is less than 5 cm, it is oligohydramnios, where I will focus on this topic in this video. Whereas if it is more than 25 cm, where there is excessive amniotic fluid, it is called as polyhydramnios, which would be explained in another video. This is the overview of the function of amniotic fluid, where amniotic fluid helps to protect the fetus from mechanical injury, allows the movement of the fetus while preventing limb contractures, prevent the adhesion between fetus and amnion, and also allow for fetal lung development. And that's why if there is absence of amniotic fluid, especially in the second trimester, these cases are usually associated with pulmonary hypoplasia, which is associated with the fetal lung development. So there are some causes of oligohydramnios, where it can be due to too little or reduce in the production of fetal urine, and it can be caused by renal agenesis, multicystic kidneys, any abnormality or obstruction in the urinary tract of the baby, fetal growth restriction and placenta insufficiency, can be caused by post-death pregnancy as well, and maternal drugs like NSAIDs and S inhibitors. It can also be caused by leakage of the liquor in, for example, preterm pre-labor rupture of membrane, can cause oligohydramnios as well. So the clinical features on history taking, the patient might complain of leaking of clear fluid from the vagina where there is rupture of membrane maybe, causing leaking liquor. And on abdominal examination, the abdomen is usually small for date, and the symphyseal fundal height less than the period of gestation. Fetal pulse obviously felt and hard due to a reduce in volume of amniotic fluid, so they are easily felt. They might be fetal malpresentation, and there is significant reduced amount of amniotic fluid and reduced fetal movement. On investigation, details scan ultrasound can be used to rule out any abnormality in the renal and urinary tract, serial growth scan to assess the fetal biometry and also assess the amniotic fluid index, umbilical artery Doppler to rule out placenta insufficiency, and speculum examination can be done to rule out preterm pre-labor rupture of membrane. To manage the case of oligohydramnios, the patient is usually referred from a health clinic or due to an accidental finding during the complaint of reduce in fetal movement, and we should trace the history, find the cause of the oligohydramnios, and investigate for the causes. So treat the underlying causes or underlying problems such as pregnancy-induced hypertension or preeclampsia. Monitor the fetal growth and well-being by doing serial growth scan 2 weekly, umbilical artery Doppler to assess the blood flow from the placenta to the fetus to rule out placenta insufficiency, and also fetal kick chart to monitor the fetal well-being. Whereas for timing and mode of delivery, if there is intrauterine growth restriction, if it is severe and causing fetal compromise, we can opt for delivery through cesarean section. If there is no intrauterine growth restriction, monitor the amniotic fluid index and can wait for labor. Whereas for preterm babies, we have to give IM dexamethasone, which is a steroid, 2 doses, 12 mg, 12 hourly. There are some complications of oligohydramnios where it can cause cord compression and causing a reduce in placental blood flow to the baby. It can also cause pulmonary hypoplasia, limb deformities such as contracture and clubfoot, preterm labor, and also there is a syndrome called Porter syndrome, where it consists of pulmonary hypoplasia, limb deformities, and also characteristic phases. That is all for this video. Thank you.